Well, from water for men and women to a treatment for both, as new technology tonight is helping to treat varicose veins. RaeChelle Davis checks out the latest developments in this month's Mississippi Valley Health Network report.
Some days, not so much. It's more of like a swelling and a heaviness.
Not only can they be unsightly, but varicose veins are often very painful. Men and women get varicose veins for two reasons. The first is genetics.
My grandma had the same type of issues, so I'm sure I got that from her because I look a lot like her.
And the second is occupation.
I'm on my feet a lot for my job and driving a lot too, so my feet would feel numb, my legs would feel numb.
Many women and men fail to seek treatment, sometimes due to a lack of understanding of the symptoms and other times out of fear. Traditional treatments can be extremely painful.
I had this procedure done like 5 years ago on the same leg, but it was much more invasive and a big deal. Like they had to put me out. So I was in the hospital surgery room, and I was probably down for about 2 weeks.
But this time it will be much easier thanks to a new way of doing things and this man, Dr. Richard Sadler. Most of his cases are now treated with only local anesthetic in about an hour or less. He compares it to going to the dentist.
The goal for any kind of vein surgery, no matter how we do it, is to remove this standing pressure that's pushing down on the leg.
It used to be that doctors would strip the vein, a horribly painful and sometimes disfiguring treatment that has a chance of permanent nerve injury. But now,
and instead of stripping the vein, we actually just microwave it. This microwave energy. And what happens is that using this relatively sophisticated little computer, we know exactly how hot to make the vein, which is 120 degrees. And then as the vein cools down, the structure of the vein now collapses on itself and shuts itself off.
Liz had the procedure called closure done a few weeks ago, and today?
The only thing that is uncomfortable is wearing the compression socks for 3 weeks, considering it's the middle of July.
As for today's patient, she'll be back to normal by tomorrow.
It's just hard for me to believe. I normally walk about 2 miles a day, and they said I could do that tomorrow. And there's no way I could have done that the first time. No way.